whether or not it was the law or whether or not it was guidance, a lot of people have spent the last year keeping their distance from their loved ones, in some cases incredibly traumatic circumstances, with elderly relatives not being able to see them, with dying relatives not being able to hug. And I just think whether or not they're going to quibble over the letter of the law, I think the spirit of the guidance has clearly been breached. But we need to hear from Mr. Hancock. He needs to say something, because at the moment, appearing as if he's going to try and brazen this out, will probably annoy people more, I think.
And that was Harry Cole, political editor of The Sun, who broke the story. Well, I can talk now to the chair of the Labour Party, Anneliese Dodds, who has issued a statement in the last few moments, which I was about to read out, but we shall let you tell our viewers yourself your reaction to this news in The Sun newspaper.
Thank you. Well, unfortunately, this saga does seem yet again to indicate that there's one rule for the Conservatives and another rule for everybody else. And ultimately, the responsibility for the management of the Health Secretary does lie with the Prime Minister. We've already seen those revelations, of course, coming out from the person who was the top advisor to the Prime Minister, Dominic Cummings, which seemed to suggest the Prime Minister had no faith in his Health Secretary. Now, today, of course, discovering that it appears the Health Secretary may well have been breaking the rules that others had to follow. And of course, we've been through a period when grandparents haven't been able to hug their grandchildren. I've just come off a call right now with some of my local nurses who've been following the rules to the letter, who are really struggling currently to deal with the impact of COVID still. I honestly think that now is the time when the Prime Minister needs to get a grip on this situation. He simply hasn't done so until now. He needs to act.
Is it tenable for Matt Hancock not to say anything about this? He hasn't commented so far, has he?
I don't think it is tenable, but I also don't think it's tenable for the Prime Minister to remain so silent about all of this. As I mentioned before, he appeared to have no confidence in his Health Secretary for a very long period and yet did nothing. He continues to do nothing. And of course, all of this is taking place when our NHS is still under tremendous pressure. Our nurses, doctors, healthcare assistants still working incredibly hard, now with the biggest waiting list on record. And yet we don't have a grip from government on this. And I think those people who are struggling within our NHS, those patients who aren't able to get the care they need, will wonder why we've still got a Health Secretary clinging on in this way and a Prime Minister appearing to back him.
Well, which brings me on to my next point. Boris Johnson is a Prime Minister who backs his ministers, isn't he? Several ministers have been through difficult patches, shall we say, and there's been no suggestion that he would sack them or that they would go under his leadership.
Well, unfortunately, the Prime Minister appears privately to have no confidence in his Health Secretary, and yet he's done nothing, it appears, to remedy the situation. And quite frankly, I don't care about the relationship between the two of them. I don't care about people's private lives. What I do care about is the impact of all of this on the running of our NHS, on people's confidence in the COVID rules, and on our country getting through this crisis. That's the ultimate impact.
Sorry to interrupt you, but do you care about the relationship between the two of them if they were in contact at a time when we were all being told that there shouldn't be any contact between households?
Well, this is the big question. If the rules have been broken, and if they have been, yet again, this will be a case of the Conservatives believing there's one rule for them and another rule for everyone else to follow. And as I said, this has been at a time when, the great British public have been following those rules. As I said, I've just been speaking to many nurses who've been going well beyond the call of duty to make sure that those rules are followed so that people are kept safe, so that especially the very vulnerable are kept safe from this disease. Really, everyone should be taking responsibility for this, not least those right at the apex of government, like the Health Secretary and indeed the Prime Minister, who seems to still be backing him.
And what scrutiny would you like to see of the actual appointment process for Gina Coladangelo?
Well, of course, this case raises huge questions, and it's not the first time that the Conservatives have been really in the firing line over their appointments, over their procurement practices, over their contracts. Really, we need to understand why this appointment was made, the circumstances around it. We need to understand, I would say, also about the relationships between lobbying here and what's taking place in government. There are many different connections between those involved. We need to understand why parliamentary passes may have been provided, whether that was appropriate. Ultimately, the Health Secretary and indeed his Prime Minister need to be transparent here. They need to be open and honest. Otherwise, questions will be raised around whether rules have been broken. And of course, we're talking here about taxpayers' money at a time when so many families are really struggling. And then there are those big questions about whether their money, public money, could have been misused.
OK, Anneliese Dodds, MP, Chair of the Labour Party, thank you very much for your time. There's been a reaction too from the leader of the Liberal Democrat Party, Ed Davey, who says, and I think we can show you his tweet, the reason Matt Hancock should resign, he says, is that he is a terrible health secretary, not because of his private life. From the PPE scandal, the crisis in our care service and the unbelievably poor test and trace system, he has utterly failed. Ed Davey there, leader of the Liberal Democrats, reacting to this story about Matt Hancock, the Health Secretary.